Hi, welcome to Healthwatch. Today we're going to be talking about Crohn's and colitis, a topic that we haven't covered on the Healthwatch program. And here to help explain it is Yu-Sung Sang, who is a physician and medical director of the Eastern Connecticut Endoscopy Center, and also the gastroenterologist at the Connecticut GI in Norwich, Connecticut. And joining him is Mary Kate Doherty, who is the chapter president or coordinator, is it coordinator?
Walk manager.
Okay, walk manager at the Crohn's and Colitis Foundation Connecticut chapter. Thank you so much.
Thank you.
Both of you for being here.
Thank you for having us.
So, Dr. Sang, I'll start with you and talk and ask you really what is the practice of gastroenterology?
Gastroenterology is the branch of medicine that deals with all disorders of the GI tract, and the GI tract essentially consists of organs starting with the esophagus, leading to the stomach, small intestine, colon, but also the liver and pancreas are involved too. It encompasses all areas in that intestinal region.
Mm-hmm. And how long have you been practicing here in Norwich?
I've been practicing 21 years.
Okay, that's a long time.
Mm-hmm.
And you were saying before we started taping today, you were saying that you kind of always knew you wanted to be a doctor?
Well, that's what my parents said. As I got into the field of medicine, I found that it was quite gratifying to be in the field of gastroenterology, because not only can you use procedures such as endoscopies to diagnose the disease, nowadays we have very novel medications to treat a multitude of GI conditions successfully now.
Mm-hmm. Yeah, I was going to ask you how 21 years is a long time. How's the practice changed since you began?
Sure, a lot has changed. I think some of the major advances have been in the field of endoscopy, evaluating the GI tract with instruments such as flexible endoscopes, capsule endoscopy, which is a camera the size of a pill you can swallow and image the small intestine, which is very important in the area of Crohn's disease, and even a procedure called endoscopic ultrasound, which is a way of imaging the inside of the GI tract without having to expose yourself to things like radiation from a CAT scan. So a lot has changed, and as I mentioned before, very importantly, there have been major achievements in development of new medications for all these ailments.
Which is wonderful, because it seems like there has always been pain in the belly for a lot of people, and maybe it just has gone undiagnosed, or you know, it's, I think at one point maybe easier to generalize and not have a specific diagnosis.
Correct.
Have you noticed that there are more diseases and illnesses related to the GI tract now than there used to be?
I think now we're just having earlier recognition of the diseases, signs and symptoms, and I think that as a result of that, we're able to detect them at a much earlier stage. So I think they've been around, but I think that now we just have the ability to detect them much sooner.
Okay, and let's talk a little bit more specifically about Crohn's and colitis. How are they similar? How are they different? And really, what are they?
Sure. So both conditions are chronic inflammatory conditions of the GI tract, and they're basically characterized by intermittent bouts of flares alternating with periods of remission. Unfortunately, these flares can lead to complications such as stricturing, which is narrowing of the GI tract, which may require surgery, abscesses, which are pockets of infection that may require drainage. There are even precancerous, even cancerous potential long-term risks from chronic inflammation. In many ways, they are similar. There are one major difference between the two is that ulcerative colitis is typically confined to the colon.
Okay.
Crohn's disease actually affects anything from the mouth down to the lower bowels.
And what kind of symptoms would somebody have in the way that they present to you?
Many times, commonly, you'll see patients complaining of abdominal pain, cramping, diarrhea, bleeding. More severe symptoms can lead to weight loss, fevers, loss of appetite, fatigue. Those are very common symptoms in inflammatory bowel disease.
I was going to ask you, how do they affect digestion?
Well, many times these patients do have trouble eating, and many times foods may aggravate their symptoms, and as a result they may avoid foods, and in such case they then tend to lose weight as a result of that.
So what do you know about the causes of these diseases, or is there a risk factor?
Yeah, right now the exact causes are still unknown. There is a small genetic component. We certainly know that there are increased risk within family members. If you have a parent or a sibling with inflammatory bowel disease, your risk increases. But again, the exact cause is unknown. One potential mechanism is an abnormal immune response. So when your immune system tries to fight off, say, an infection, and a normal immune response may result in your immune system attacking the cells of the digestive tract, which then in turn leads to the flares and symptoms of inflammatory bowel disease.
And Mary Kate, let's bring you in here. Can you talk a little bit about how many people are living with these diseases, and kind of what are you seeing or concerns from people in the community?
Sure. So in the United States, there are 1.6 million patients. Here in Connecticut, there are about 18,000 patients, including 800 pediatric patients. So certainly, you know, all of those symptoms that Dr. Seng mentioned are, you know, top of mind for patients. As you can imagine, a lot of those symptoms lead to a lot of day-to-day upheaval to have to contend with in terms of, you know, your stomach being upset, you're dealing with joint pain, you're dealing with a lot of fatigue. So really those symptoms are, you know, kind of top of mind concerns for patients.
And is there something that somebody can do to prevent this from coming on?
Because we don't know the causes, we don't know if these can be prevented. So, you know, right now, as Dr. Seng mentioned, there is a genetic component for, it's about 15% of patients. These are autoimmune diseases. So it's your body attacking itself, which would tend to indicate that, you know, on the surface, it's not preventable. Now, as we, you know, move into identifying all the genes and gene therapy, you know, might we be able to, you know, alter some things in the future?
And is it more common among men than women, or at a certain age?
No, actually, it's it can affect anyone. There are certain age ranges where the diagnosis rate is more prevalent. The most common is between the age of 15 and 35. But we then see another spike in the post-60 age range. But honestly, you can be diagnosed at any time.
And is it affected by, or does it affect pregnancy?
In general, if you are in remission, that is the best time to become pregnant. So when you're feeling well, the baby's going to feel well. Typically, pregnancy maintains the disease at its stage. So 1/3 patients will stay well. Unfortunately, 1/3 patients will also have flares during the disease, and about 1/3 actually will get better. So it does definitely have a complex interaction with pregnancy.
And is the trend towards more and more people experiencing Crohn's and colitis?
We definitely have seen an increase, and we are starting to see more and more cases in developing countries that are getting more use of antibiotics, more advancements in medical care. We are seemingly seeing more cases of it. Whether it's better detection, that remains to be seen.
Interesting. And you mentioned that there's been some development in treatments for GI problems. Does that follow suit in terms of Crohn's and colitis? Are there new medications?
Typically, the medications that we use range from medications such as anti-inflammatory agents called mesalamine drugs, and then it ranges to more potent medications, steroids, immunomodulators, and then there's these new agents called biologic agents. Many of them are quite effective in treating and managing the condition. Again, it's not a curable disease, but it is manageable with these newer medications.
Does it ever warrant surgery of some kind?
We typically try to avoid surgery, especially in Crohn's disease, which we know that surgery does not prevent Crohn's. It treats the complications of Crohn's. And also colitis, as I mentioned before, since that condition is confined to the colon, surgery can potentially be curative for that condition.
So what are some of the most common concerns that patients come to you with?
Typically, the patients will have bouts of symptoms that really can disable them and keep them out of work, affect their activities of daily living, and really just affect their quality of life. And they really do seek help in terms of managing many of those symptoms so that they can function normally.
Well, thank you, Dr. Sang, for being here. Mary Kate, you're going to stay with us as we go into our second half of our program. So nice to meet you, and thank you very much for the great description of what Crohn's and colitis is.
Thank you.
And stay with us. We'll be right back.
Vision loss is not something that you feel until it happens.
Most people lose their vision from diseases like macular degeneration and glaucoma, not at birth.
With macular degeneration, you lose your central vision.
You have a blind spot right in the center of your face, so I can't actually see your face.
So even that little circle in which I could see became a big blur.
I was 65 when I first was diagnosed with glaucoma.
There were no symptoms. I had no headaches.
3 million Americans have glaucoma, and half don't even know it.
11 million people in the United States have macular degeneration.
You lose mobility, independence, changes your entire life.
So many eye disorders can be treated if caught early.
My husband tells me that I have beautiful brown eyes, and I don't want to lose that.
Make a plan today to get your eyes checked.
Visit brightfocus.org to learn more.
Can I go to the sleepover?
Lucy, I want you to promise me something. If there's any drinking, I want you to say, "No thanks, not my thing."
Mom.
I promise you, your real friends won't care. Deal?
I promise, Mom.
They really do hear you.
Did you pack your toothbrush?
For tips on how to start the talk, visit underagedrinking.samhsa.gov. A public service message from the Substance Abuse and Mental Health Services Administration.
Welcome back to Healthwatch. I'm Cindy Barry, and today we're talking about Crohn's and colitis with our guest, Mary Kate Doherty, who is the Take Steps Walk Manager for the Crohn's and Colitis Foundation of America's Connecticut Chapter. And also we've been joined by Fran Clark, who is a colitis affected patient who's going to be sharing her story today. So thank you both again for being here. I want to talk, Mary Kate, a little bit about the foundation itself and the kinds of services and programs that you provide.
Sure, thank you. So the Crohn's and Colitis Foundation of America, we fund research, but then we also offer local patient services and resources. So here in the Connecticut chapter, we have 3 monthly support groups. We also have a women's group that meets every other month. We have a pediatric camp, summer camp for kids. It's called Camp Oasis, where the kids can go for a week of traditional summer camp with medical care provided so they can continue their treatments. We do a series of educational seminars and symposia. And then on the national scope, we also have our IBD Help Center. That number is 888-MY-GUT-PAIN. So anybody who has been diagnosed or who has a family member diagnosed.
And Fran, I know that we've talked before about your condition a little bit, and you wanted to tell a little bit of your story. Maybe how did you find out that you had colitis?
So shortly after graduating college, I started having issues with stomach pain, bleeding, diarrhea. I ignored it, decided it was stress. About 3 years of doctors suggesting maybe I see a gastroenterologist, and I'm like complete denial, said no way. So finally In 2001, I did make an appointment with a gastroenterologist. I had my first colonoscopy at the age of 26, which I thought was too young.
Wow.
And was diagnosed with colitis. Unfortunately, I had difficulty getting into remission, even though my doctor said my case was mild to moderate. I didn't respond well to the medications at the time. So 6 years ago, I started one of the biological therapies that's out there, and it's changed my life.
So do you feel like your story is kind of typical of people that have been diagnosed, maybe kind of putting it off, really not kind of knowing what it is, but it's not going away?
Yeah, for those that I've met, because I do attend the support groups from time to time, it's very typical. The more severe cases usually are diagnosed faster, but any that are something that you can blame on stress, which always affects the gut, or something like that, are usually misdiagnosed or people put it off.
And you talked about some of the symptoms. What was the pain like?
It was more annoying. It wasn't very severe pain, but it was like a cramping constantly. It hardly ever went away. So I don't know how I ignored it so long.
And what kind of support, you mentioned that you attend some support groups, what kind of support have you gotten around your illness?
The support groups here are great. You actually have people that understand what you're going through. Because people tend to be really embarrassed. You know, sometimes people lose control of their bowels while they're out in public, which happened to me once. And I get people who understand that, and they don't think that there's something like majorly wrong with me, that I can't control myself. So it really helps to have people that understand.
And you mentioned different kinds of treatment. Is it common to try different kinds of medication, for example?
From my experience, it is. Doctors tend to start with the mesalamine drugs that Dr. Sang mentioned, and then move to higher levels if those are not, if those don't work. But I don't know that it takes 10 years like it did for me. So.
But essentially, it's a chronic condition that's not going to necessarily go away altogether.
Correct.
There's no cure for it. Let's talk a little bit about how you got involved in the Take Steps walk.
Well, actually, I was involved with other walks in the past, and I moved to Connecticut 6 years ago, and they didn't have the same walk here, so it was a little difficult for me to be involved. So I actually went looking for something else to do with my time. And I went to a symposium my first year in Connecticut and met a lot of the people who arranged the walks, and after talking with them, I decided to volunteer.
So we're going to watch a video that describes what the walk is, and then we'll talk about it after. Okay?
Fantastic.
I was at a wedding and I had an accident and there was a little bit of blood in it. And so my mom and dad thought it was strawberries because I ate a lot of strawberries. We went home after the wedding and then it just kept getting worse and worse. And they said it was ulcerative colitis, and we were like, wait, what? And so he's like, okay, let's try surgery. I was in the hospital for 5 days.
It's crazy for us because we've never heard of ulcerative colitis ever.
But even Googling it, like, you read about it, you still don't understand it. Like, I still was like, okay, so it does this and that. But her first doctor was really good, like, oh, you should check out the Crohn's and Colitis Foundation.
Take Steps is amazing, and it's great because it brings so many families together that wouldn't usually come together, and we've got a lot of great events, not only the music and the food, but it's more about the camaraderie and meeting people so that you know that you're not alone in this walk.
like a party. We're all getting together and we're making noise to say we're out here, we're raising money, we have this disease, but we're not going to let it stop us, and we want a cure. And if you have this disease, come on out and party with us.
We met a lot of other people in the community that I hadn't met previously. So we met bankers, accountants, attorneys, everyday people who became patients of our practice. And we didn't do it to promote our business, but by just being involved in the community, there's no question that it helped promote our company.
So I took steps because I know if we do this, we can help the cause and cure Crohn's and colitis.
I take steps for my brother.
I take steps because we need a cure.
By participating in Take Steps, it gives us a sense that we are making a difference in the world, that we are adding our voices to hundreds of others and showing our compassion for thousands of others, and hopefully making a difference for even many more.
I take steps for those who can't take steps for themselves.
Because it's fun and you're raising money for CCFA to find a cure, and if they do, then all the people that have Crohn's or colitis can get a cure.
So great video about the walk. That's got to be really exciting. Let's talk a little bit about the local walk that's happening in Guilford.
Sure. So our local walk, it's the Connecticut Shoreline Walk. That is coming up on Saturday, October 22nd. We will be at the Guilford Fairgrounds, and we certainly encourage the public to come out and join us. We also certainly encourage patients and family and friends to form teams, and they can register ahead of time and get all of our updates in terms of what we have planned.
Okay, and are you looking for volunteers, Mary Kate?
We are always looking for volunteers. Yes, we could not do any of what we do without volunteers. So folks can go to the website, which is www.cctakesteps.org/CT Shoreline 2016. From there, they can tap into volunteer information, team information. All of my contact information is there. So
great. Fran, what is your role in the Take Steps Volunteer Planning Committee?
So I'm in charge of all the entertainment for the walk. So that's finding stuff to keep the kids busy and have a good time, and entertainment along the walk as well.
And what are you looking forward to most about the walk?
Probably just the getting everybody together and everybody feeling like they have people who understand around. It's always good to get a bunch of patients together, and their families get a lot out of it as well.
Great. What other activities will you be offering this year, Mary Kate?
Sure. So yeah, Fran's got a great lineup. So we've got a DJ, we've got plenty of refreshments. We'll have a bounce house, a raffle. We've got a merchandise store for the first time. We'll have some carnival games, pumpkin decorating.
Great.
So it's a great, family environment.
And Fran, I understand that your employer Pfizer is a sponsor.
Yes. After meeting Mary Kate, I don't remember who suggested it first, but I got her in contact with somebody who does community outreach at Pfizer, and we were able to get them to be a sponsor, which is great.
And are there any other sponsors that you wanted to recognize?
I would love to. Thank you. Yeah, we really appreciate all the sponsors that we have, and our pharmaceutical partners are a huge help. So in addition to Pfizer, we have AbbVie, Takeda, Bristol Myers Squibb, We then also have some gastroenterology practices, including Dr. Sang's practice, Connecticut GI, and Gastroenterology Center of Connecticut down in the New Haven area, as well as Yale New Haven Hospital. So very appreciative of all their support.
And how can people reach you if they want to get more information about Crohn's and colitis?
Sure, so my direct line is 203-376-4336. There's also, as I mentioned, the Inflammatory Bowel Disease Help Center. That number is 888-MY-GUT-PAIN, and that's available 9 to 5, Monday through Friday.
Okay. And Fran, you were talking about how families can come out during the walk, and it's a great way to support their loved one. Are there some other things that families can do to help support the person that is affected by Crohn's or colitis?
Yes, a big thing that patients struggle with is food. And there is no one diet that works for every patient. So I know I have experienced the holidays where food pushers kind of get a little upset when I won't eat their food. So it really is helpful when people understand that it's nothing personal. I don't want to get sick.
Yeah, good. Well said. I want to thank you both for being here. It's a subject that we haven't talked about on Healthwatch, and I learned a lot, so thank you very much.
Thank you for having us.
And thank you so much for tuning in today. I hope you have a wonderful day.